surrender. I need you now. Hold my heart now and forever. My soul cries out. Once I was born, you loved my whole heart through. Sin has no hold on me, 'cause your grace owns me now. And that grace holds the ground where the grave gate. Where all my shame remains, left for dead in your way. You crashed those angel gates. You left no stone unturned. You stepped out of my grave, showed me a way. So here we stand, Lord. Here I stand. Come on. I surrender. I need you. He's a present God. He's here. Hold my heart now and forever. My soul cries out. 'Cause once I was broken, let me tell you, you love my whole life through. Sin has no hold on me, 'cause your grace holds me now. I'm healed and forgiven. Look where the chains are now. Death has no hold on me, 'cause your grace holds that ground. And your grace holds me now. 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 I can tell you these are happy tears, these aren't sad tears. These are the tears that says God is good and He is restorer and He is redeemer. And I want to invite you into an altar moment with Jesus, because this song represents that for me. You know, for 5 years I held on to broken dreams and relationships and things that I couldn't fix. But the crazy thing is when you hold on to it, nothing happens and you just become burdened. But when you release it to God, who is the restorer, who is the redeemer, who is the reconciler, that's when His grace works. And He brings beauty out of ashes, and He does a thing that only He can do, and He works in mysterious ways. And I don't know if it's going to happen in a moment tonight that it breaks, but I am believing that it can. That a moment in the presence of God, it could happen tonight. So if that's you tonight and there's things that you need to release to God, there's things that you need to say, you know what, I can't do this, Lord God, but not my will, but your will be done in this part of my life. If that's you, would you lift your hand tonight? It could be big, it could be small. But the cool thing is, this isn't about me, but this is between you and Jesus. And I believe that there's going to be freedom in this place, because it is for freedom that He set us free. Come on, you sing this out. Here I stand, I surrender. I need you now. Hold my heart now and forever. My soul cries out. Here I stand, I surrender. I need you now. Oh, He's right here. Hold my heart now and forever. My soul cries out. Here I stand, Lord. Here I stand, I surrender. I need you now. Hold my heart now and forever. My soul cries out. 'Cause once I was broken, but you love my whole heart through. Sin had no hold on me, 'cause your grace holds me now. Thank you, Lord. I'm healed and forgiven. Look where my chains are now. Death had no hold on me, 'cause your grace holds that ground. And your 'cause your grace holds that ground. Come on, the power of confession, you sing. I'm healed and forgiven. Death could not hold you. Victor before you. You silence the voice of sin and grave. The heavens are roaring the praise of your glory. For you are raised to life again. You have no
Welcome, everybody. Welcome to this special conversation that we're having. It was 1 year ago this weekend when the world changed for not only the world, but for us here at Homewood. That was the day that it was announced that the pandemic was real, and I remember this when we got the email that said that in-person services at Homewood were being canceled for the first time probably ever for something like this. And it was a realization that this was not a passing thing, but this was something that's going to have profound impact on the lives of many of us. Since that time, more than 500,000 Americans have died, more than 10,000 Alabamians have died, and we've also seen the impact right here in our church family with members and family members of members passing away from COVID-19. But thankfully, there seems to be hope on the horizon. We wanted to take this afternoon to just take a few minutes to look at where we are in this COVID situation, and perhaps more importantly and more hopefully where we're going with this. And we are blessed at this congregation to have two people who are very well versed in this conversation and who have gratefully allowed us to share some time with them today. So I want to introduce to you, I need to introduce to you two of our members, Dr. Stephen Stair and Dr. Rebecca Savage. Dr. Stair is an internal medicine specialist, and Rebecca is a adolescent health specialist. They are both at UAB, they are both MDs, they have both been steeped in what's been going on with the pandemic over the past year or so. I will take the liberty of calling you Stephen and Becca because we're friends here.
Absolutely.
But also you're friends with everybody who's watching us today. So we want to thank you for taking time to watch it. And if you have some questions, you can be able to ask them as we go through this 45 minutes to an hour on this conversation. But I wanted to start and just jump into this, Stephen, with where we are with the state of COVID-19, the coronavirus in Alabama today.
Sure. Thank you, Willie. Really appreciate the chance to be here. It's an honor, and been at Homewood for nearly 30 years now. I know all of you and really appreciate the love you've shown us. The healthcare profession has taken a real hit too in this past year. We'll talk some about that. I do have a few graphics to show you, and if we can go ahead and take a look at our first slide. As Willie said, we are at 540,000 deaths as of today in our country. That's tragedy. Who would have thought this time last year, as we sat on this stage, the three of us with Dr. Pruitt and Brett, that we'd be where we are now. And it's been devastating for our country. We haven't seen anything like this really for 100 years, since the 1918 influenza pandemic. What's really interesting and sad also is that the U.S. only comprises 4.25% of the world's population, but we have 20% of the deaths that have occurred. There's a lot of reasons why that is. I think there's a lot of hope and encouragement as we move into this next phase, and we'll talk about that some today. Let's take a look also at the next slide, and this is a slide, I did not realize this, but the National Statistics Institute did a study on life expectancy and how life expectancy has changed in 2020. And if you can believe it, we have seen African American male life expectancy decreased by 3 years. 3 years. And you can see the Hispanic and Asian and non-Hispanic and non-Asian population. Now, of course, this will improve as we move past the pandemic and get to the point where we want to be. But we're going to talk some about health disparities, about inequality and why that is. But it's devastating. The next slide shows you, even if you have the people that have not died from COVID, many of them have been left with a lot of long-term effects, long-term side effects. We call these long haulers. That's a new term since last year. And you can see, I'm not going to read all the symptoms, but many of you who have had COVID, who have dealt with prolonged symptoms, can recognize that there are significant cardiac and pulmonary and neurologic effects that can linger for a long time. And there are a lot of studies that are being done right now to take a look at these patients and why this is happening, what the inflammatory response did, what caused this, and how we can better treat it, because it's been very, very challenging. People are losing work, they're disabled, and we've got to figure out why. So there's a lot of studies going on for that as well now. The next slide starts to turn the corner for us, Willie. This is the number of cases since we started 365 days ago. And you can see the spikes as we moved on through the past year. Many of them were seasonal, based on whatever it was, whether it was the holiday, spring break. And you can see the major spike 84 days ago when the holidays came. The most encouraging sign is the last 2 months. And you can see what's happening in Alabama, in most of our states. The cases are dropping dramatically. There are probably several reasons for that that we're going to talk about. One is certainly immunity. A lot of people have had COVID, more than the cases that we've measured, actually. And there's a thought that about probably for every one case that was diagnosed, probably 4.6 other patients have had it. So we're talking about a 5-to-1 ratio, which is going to be encouraging when we talk about herd immunity. Another is vaccines. Vaccines have certainly started taking effect since December. People are better about wearing masks and protecting themselves. So there's a lot of factors that have come into this dramatic decline. But I think it's still a little too early to say, let's go run free. There's a lot more we need to deal with. So the next slide actually talks about hospitalizations. So a lot of people think, well, there's less cases because we're just not testing as much, which is true. We're not testing as much with the vaccine around. But what we are seeing that you can't argue with is hospitalizations are dramatically dropping. Just in our state, you can see we went from nearly 3,000 right around the holidays, January. We're down under 500 now. And UAB's numbers have dropped dramatically over this last 2 months. We had 300 people with COVID in the hospital in January. I think I saw 94 this on our last report. We get those daily reports. So, this has been great for the concerns about hospital overcrowding and ICUs. We certainly don't want it to spike back up, but we feel like this is really a good sign that we're heading through the worst of this. So that's really kind of the baseline of where we are right now, March of 2021, compared to where we were last year.
I think you raised some great information about the physical impact that this has had on this community, and particularly for adults. I think those numbers probably reflect more adults than anything else. But I'm curious, Becca, to ask you about what you think this impact has been on the mental health, the mental situation, the emotional stability of people in this community, particularly the people you treat who are younger people, who are teenagers and younger. How has this impacted them emotionally and mentally?
Yes, so I see only adolescents right now, 11 to 21-year-olds, and I would say, just to summarize, that we have been seeing a spike, a great increase in behavioral and emotional issues, and issues like anxiety and depression, that would be at the top, and then also an increase in eating disorders or disordered eating type behaviors. And also in suicidal thoughts and substance use. So in all those things sort of overlap in different ways, but just in what I'm seeing at my work, we've just seen a lot more of that in the last year. And I think that there's many different factors that play into that, but one of the big ones and most obvious ones is that adolescents require social time with their peers to develop emotionally and develop socially, and to have sort of normal mental health. And so with the changes that started a year ago with schools being shut down and virtual only, and then the fact that a lot of schools still are only virtual, and just because of different things we can talk about, different reasons, it's taken away a lot of that normal social development and normal time that they have with peers and interacting. And I think that's just one piece of of many other factors probably weighing into that.
So it's about the isolation, it's about the fact
Right.
they're not socializing as children generally do. Do you see this impacting more the older children you treat, or is this impacting more the younger children? Is there a difference in how it's impacting them?
That's a good question. So I think it shows up differently depending on their age and their developmental age as well. So age, like chronological age, doesn't always line up with developmental age. And so in the younger children, we may see more somatic symptoms, as we say, so physical complaints, abdominal pain, headaches, things like that, or other signs of anxiety, like they're not sleeping as well, they're more irritable, things like that. In older teens, I feel like they can sort of think more deeply about what's going on and sort of process it a little better, and so they may be more able to talk more about like how it's affecting them, but they still may become more withdrawn, more depressed, anxious, and might have more just thoughts potentially about suicide, even though we see suicidal thoughts happen and intent happen at all the ages, I would say, as young as 12, 13 or even younger, but it tends to get a little bit more prominent with the older kids. But I guess what I'm trying to say is I think it's affecting all the ages probably similarly. It's just they're manifesting in different ways, I think.
And we're going to talk about the psychological impact of this a little bit more later, but Stephen, I was wondering if you can give us some comparison of how Alabama is doing compared to other places. What's been the impact on that? We were one of the first states in the South to impose a mask mandate. We will apparently be one of the last to get rid of it. Do things like that have an impact on where we are right now? How do you think we compare to other states?
That's a good question. It's very state dependent on political scene, on the governor, on the mayors. We have, kind of left it up to individual communities, counties. Some have done better than others. Alabama struggles with our minority population. I mean, that's just the reality. I'm going to show you some slides related to the vaccine in just a little bit that will show that. We have, and we probably have an increased amount of patients who have significant chronic illnesses, more than some other states. Diabetes, heart disease, COPD, obesity. Of course, about our issues in Alabama with obesity. So there's no question that I think if you looked at the average citizen in Alabama, we are probably in the top 10 states of patients who are at risk for our citizens versus some others, for sure.
So it's the comorbidity issue that
Exactly.
is one that drives the numbers here, not so much
Absolutely.
the response to the virus itself.
Absolutely.
One of the things that you said that was disturbing, and explain a little bit about the fact that for Black men, life expectancy has gone down 3 years.
3 years.
That's pretty
That was
unprecedented,
stunning.
isn't it?
Yeah, that was stunning. And I think you probably know, and we've read a lot about why that is. There's mistrust of the healthcare industry. There are a lot of folks that don't have a doctor, don't go to the doctor. There are concerns about vaccines themselves. There are concerns about what happened back with the Tuskegee experiment and all the things that have happened in our country that have been negative. What I have found, though, is trusted providers and trusted peers in the community are by far the best way to make an impact. I have patients who come to see me, we talk about the vaccine, they buck up, I'm not taking that. And we talk about it, and I ask them why. And they say, I had it 2 months ago. You had it? They really they don't know anybody that's had the vaccine. And when they hear about somebody that had it and did okay, that's helped. So I've been proud of the fact I'm nearly about 100% of our folks who have that kind of hesitancy once we talk and once we get through it. Now, there's a percentage of folks, Willie, you're not going to convince them. They're convinced there's a conspiracy and all this it's just too early and we don't know the long-term effects. When I talk about the millions of people that have had the vaccine without any problems, and we talk too about why it really hasn't been as fast-tracked as people think. This research has been going on literally for 100 years. Since the influenza in 1918, we started to know what was happening, how pandemics worked. And then SARS came out in 2003. That was a very similar structure of the coronavirus now. And so we were able to just really quickly, on a fast track, because we had a lot of clinical trial participants, hundreds of thousands of participants, we got a lot of data very quickly. We're able to see the safety and the efficacy of these vaccines. So those are things that I try to explain to patients, and then we try to get out. Our Dean of the Medical School, Dr. Selwyn Vickers, is a huge proponent of this. This is his really one priority, and he's a hero of mine too. He saved my life 20 years ago. And so UAB is very proud of how we're handling that. I'm going to show you some numbers too that'll merit that out.
And we're going to jump to vaccines in a moment, but I was curious about something. Do you sense that there is a difference between the way urban Alabamians and rural Alabamians look at this? I think, especially if you look at the situation of black men, you would think that those in the Black Belt and other more impoverished parts of the state have been exposed more to COVID and have dealt with it more on a personal basis than perhaps others have. But has it had an impact, do you think?
I don't know.
How it's accepted?
That's a good question. I'm not in a rural-based, clinic like others are. I do think there's a lot of folks in these communities who just don't want to deal with doctors. They don't want to deal with it. They just want to go about their lives. They may be more protected because they are a little more isolated, and whether they're wearing masks or not, it's hard to say. It's been a real challenge. It really has. So I don't think there's probably as much of a difference as people think.
Let's talk about vaccines, because I think that's what's on a lot of people's minds. Those who don't want to get it and those who are desperate to get it and can't.
Absolutely.
Can you talk a little bit about that data that you've experienced?
Yeah, let me show you where we are. This is a really important website. It's very easy. It's vax.uab.edu. Please put that in your history and check it. I look at it just about every day because it is amazing to me, 1 year from the time that we were here talking about this virus and what's going on, that we have 105 million people in our country vaccinated. You can see by the state map, Alabama is a little lighter blue than we'd want. We're not the lightest, which is good. We still have a ways to go. But you can see
something about Alabama. We always compare ourselves to the worst, and as long as we're not the worst, we're okay.
Well, I'm going to show you how we're one of the best in just a minute. Okay, I'm going to show you how we're one of the best. If you take a look at the vaccines, we got Pfizer, Moderna, and now Johnson & Johnson is really taken off. That is the one-dose vaccine. It's a little bit different than the other two, but it's as effective for preventing severe illness and death. In fact, the Johnson & Johnson study had 0 patients die in the vaccine arm. The only patients that died were in the placebo arm that didn't get the vaccine. So you can see where, and any one of these vaccines is fine. I would take any one of them myself, absolutely. So wherever you can get the vaccine, get it. The Johnson & Johnson is 1 dose. The other 2 are 2 doses, 3 or 4 weeks apart. The line on the right, on the graph with the yellow bars, those are the states that are the furthest along with their vaccine percentages. The white column on the right is herd immunity. That's really considered to be 72%. Okay, 72% vaccinated or immune. And if you look at the bottom graph, those are all the states with the population versus the amount of supply of vaccine that's available. Okay, so now you see what our real problem is right now, March 14th of 2021. It's vaccine supply. Okay, we've got people that want it. We've got places ready to give it. We feel very confident that's going to get better in the next month. We're going to see, I've heard that 40 million doses are being released of all 3 of the vaccines. I know it's been very frustrating. Willie and I were talking about the frustration when you want to get the vaccine, you're eligible, and you still can't get it. It's coming. We're going to all be able to get the vaccine. And I want you to be confident.
And not to interrupt you, but I think one of the things that we keep hearing, because for instance, we get, as church staff, we get prayer requests. And a lot of those prayer requests say, please, how do I need the vaccine. I can't get it. I'm praying for that. What hope can you give them as far as time frame? Because a few weeks is nice, but it seems kind of vague. Is there some way to be a little more specific about?
I wish I could be. It's very dependent on the processes of the federal and the state governments of how they're released. Okay, I can tell you, UAB has 5 vaccine sites starting next week. We can give about 20,000 doses a week. We've already given about 100,000 vaccines, just UAB sites. So it's just a matter of getting the vaccines from the state. I will tell you, if you don't mind driving an hour and a half, you can find the vaccine in some of these smaller towns.
And why is that?
I don't know. But there are probably less people per capita to get the vaccine in say, the area of where Winfield or Jasper or Coleman are. And so there's just vaccine available at those pharmacies. So that is an option. That's hard for older adults,
Right.
I know. Get on every list you can and just try to be patient.
And so to drill it down, it sounds like the challenge is for people who live in Jefferson and Shelby County at this point to have easy, quick access to the vaccine. But if you're willing to drive an hour in pretty much any direction, you may be able to be more
You
successful.
can get on the list. That's where we are right now. I hope in a month it's different.
You mentioned the state supplying the vaccine for UAB, but I understand there are also federal programs that may be operating through places like CVS and Walmart.
That's true.
How does that work?
Those are all available now. It's just the same thing. There's registrations. You go to the site, you sign up. My wife got a vaccine at Walmart in Fayette, Alabama this week because she went through the process. They have some waste protocol. She's now eligible per Walmart protocol actually there, and you'll see this week it'll be 55 and over. So not that she's even 55 yet.
No, I would never suggest that. No.
So
Forever
yeah.
39.
So you're right. CVS, Walgreens, Walmart all have the vaccine in, I think, most sites now. It's still, they might get 500 doses, at a time.
I think one of the other frustrating things about this, because we all know there are frustrating things about this, but there seems to be no central place to go to find out who has vaccines and who doesn't have vaccines.
All right, I'll tell you the site.
Yeah, that's what I said.
And we can put it, if you need to put it on the screen, it's alcovidvaccine.org. alcovidvaccine.org. That is the kind of the central site. Now, that's going to get you to any vaccine distribution, including UABs, if you go. Now, there are other walk-up sites that will be shown on that website as well. Now, you look, and you don't see any available for 50 miles.
Right.
I know, I've done that. I do that all the time. So all we can say is, patience, you will get the vaccine.
And you're saying that website will tell you all the providers,
It will.
the
Exactly.
drugstores, the
It will
superstores.
plug you in to the next available site. However long you're willing to drive, that's where it'll be.
And we will repeat that address later on so that people want to write it down and get a chance to do that. Becca, one of the things that has been a big issue of controversy is the fact that the vaccines have not been approved for younger people. And not to say that they're unsafe, but they just don't know yet. How has that impacted families and parents and how they try to move forward in this situation?
Right. I think it's just frustrating probably for a lot of people because we just don't know how children are going to tolerate the vaccines that we have out right now. I mean, they're just new. They've been out for not very long. They're approved for adults. I believe 18 and up, right, Dr. Stair? I think it was, so I don't think any are 16 and up. But I know there's a lot of studies ongoing about the safety and efficacy in young people. So, but just from what I've been hearing and talking to parents, I think that we're having, a lot of times the parents are more, I guess, challenged with finding their own vaccines for now, and also, again, just the waiting for their own, and then also to hear more about the kids. It's hard to wait. It's hard to be patient. So yeah, but I'm hopeful that there will be some vaccines out for youth, but I think it is going to take months, if not years, to kind of know that.
We know that when it comes to schools, some schools are fully open 5 days a week. Some schools are hybrid, partial virtual and partial in person. Some are just all virtual.
Yeah.
Do you discern any difference in how kids react to those different situations?
Yeah, another good question. So whenever I'm seeing young people, I'll put it this way. I usually, just ask how they're doing. Like, how do they like virtual? How do they like in person? And I would say, from what I've heard and also from what I've read from others, is that it seems like most kids just like being in person better, and they tend to do better because of the structure, again, the social part of it. I really will talk again about structure, because I think just structuring the day for a teenager who is not going to in-person school is very challenging, and that drives a lot of the physical and mental health problems that are going on. I'll say specifically sleep is a big issue. So of the patients I have that are all virtual, for example, I haven't met one yet that starts school earlier than about 10 or 11 in the morning. A lot of times it's lunchtime, we're getting up because usually they're only required to be online for a few hours. So they do that during the sort of lunchtime to afternoon hours. I know some schools might be different, though. They require you to be on a certain time. But I guess I'm giving you my experience. So, and so then that shifts their whole day. They're up till all hours of the night, which I know teens are anyway, a lot of times. Sleep is a really difficult topic for all teenagers.
In any circumstance.
Yes, exactly. But it makes such a big difference to have a normal routine in general, but also sleep schedule for mental health and for your physical health. So that's just one example of a huge challenge and a difference between these kids that go in person and the kids that don't, is because those kids who are still going in person, they have their schedule set. They have to be at school at a certain time. They do their extracurriculars after school, which a lot of kids I have too do this virtual school, but they still will go in person to do the extracurriculars like the cross country or whatever sport they're doing. They'll still go in person for that, but that'll be the one thing they go to. And then, sleeping is just so important. And so that's one piece of advice for all of these patients on virtual, just still staying on a routine.
Of course, sleep is important for a lot of people who aren't getting enough these days.
Right.
I wonder, though, if there's a flip coin to this, too. I mean, for instance, children who have learning disabilities or who have difficulty socializing, there are anecdotes that say that some of those kids are doing better because they're not forced to be in a social situation where being around people may not be as beneficial for their learning. What do you hear about that?
I have heard that before. So I will say it's family dependent and teen dependent because, that's why I always ask, some people find that the flexibility has really helped, especially if there's developmental issues or other concerns. But it makes me I hesitate with the social anxiety piece to say that it's good to keep the kids out of school, because it's also that bit of sheltering in a way that's not allowing them to address their social anxiety. It's letting them kind of continue to withdraw, that can end up making things a little bit worse in the long run, like if they are going to eventually enter the world again. And, I guess what I say is maybe for some it would be helpful to have that option to stay at home and kind of, I'll give another example of a good option to stay at home. Like I have some young people who are really struggling with eating disorders, and it's easier sometimes to supervise feeding and like meals, snacks, etc., when they're able to work from home, if their parents also working from home. So, and that's the other piece of this, like parents having to work from home and monitor and keep up with what the kids are doing with their schoolwork. It's just, borders on impossible in a lot of ways, and it's just very, very, very stressful for all parties involved. So, another pro of in-person school there. But I will say it is always family dependent. You can't ever have a broad conclusion for all, because there's different circumstances. So.
Stephen, we've been talking about the mental impact and psychological impact on kids. What have you observed about how this has affected adults mentally and psychologically?
I do have a graphic on that. It's the last slide, if you guys don't mind pulling that last slide up. In October, the American Psychological Association did a study on stress in America. It's the next one. There we go. I know this is a busy slide, but it's really, really interesting to see what they found in adults. And I see this every day in my practice too. I've got senior adults who break down in tears because they can't get with their social group. They can't get together with their friends at the restaurant, or they can't get together to play cards, or they can't get together with couples and friends. And it's really, really challenging. A lot of depression, absolutely, in that age group as well. So if you take a look at just some of these facts, and I'm not going to read through each one of them, but we're talking about, weight gain. Weight gain is a huge detractor for physical health and mental health as well. And some people have gained, the average of like 29 pounds in the people that were really worried
Which
about,
adds to the
about the weight gain.
comorbidity
Absolutely.
situation too.
Diabetes, hypertension is directly associated with that. Sleep issues, Becca mentioned that in children. It's certainly true in adults. Too much or too little sleep make a huge difference in your physical well-being and your mental well-being as well. I'm really concerned as a primary care physician about delaying routine care. How many people haven't had a mammogram? How many haven't had a colonoscopy? Haven't had their regular vaccines they need to have? They've been staying at home. What are we going to see 5, 10 years from now? Based on that, we're going to see a little bit of an increase in cancer surveys. That's a problem too. The level of stress in their life has increased for parents, and Becca just covered that. Mental health, professionals, healthcare workers seeking mental health has gone up significantly. African Americans are concerned about the future, more of them than any other adult. And then the Gen Z adults, that's the people born from 97 to 2015, so the 18 to 24-year-olds are very concerned. Their mental health has worsened as well. So even folks that are considered to be young and not as at risk from the vaccine or from COVID have dealt with so many changes in their life with work and working remotely and not being able to see their friends and going to things that they do. And we have two wonderful girls that age, and they've really struggled. It's been really, really hard. Concerns about getting COVID, concerns about not being able to be with their friends and do things. I mean, the freshmen in college and the seniors in high school, they'll never get that back. And so those are things that affect them. And so it's a significant problem. And I think it's going to be something after we're through the worst of this that we're going to be dealing with for a long time.
Well, I do have felt so horrible for high school seniors and college freshmen the past year, because those, as you say, those are experiences you'll never get back again.
Right.
You'll never be able to do prom again. You'll never be able to do freshman orientation week again.
Right.
And have those situations. One hopes that they'll find ways to deal with that, but the group I want to talk about just for a little while is seniors and what they're going through. Because not only is it a matter of them not being able to be around their friends or their social groups, they can't even be around their families to some degree.
Right.
How deep an impact do you think that has on them?
It's a huge impact. This is the age group that I take care of at UAB. I talk about it every day. One thing it's done, it's mobilized them to want to get the vaccine. So that is a huge motivator. And I've got a slide on here to show you what just came out from the CDC last week about what can be done. In fact, let me go to that slide about the, not this one, but let's see, next one. Well, actually that last one is important, okay? So this is exciting, okay? This is official from the CDC and from Alabama. We're going to expand to all 55 and over starting next week.
Right.
Now, and I think what that's going to do is help to mobilize more vaccines to our state, I hope, so that you can get yours.
Because if you expand the eligibility but don't expand the availability.
So there's optimism that's going to happen. Next slide. And I do want to deal with this. This is probably the most important slide of the day, okay? What this slide shows is the orange section at the bottom are positive tests for people that we know are immune, okay? We know they're immune. The green section is the probably 4 to 5 times number of people that actually had COVID that did not get tested, okay? So that takes us up to 1.8 million. And then you look at the top yellow curve about the vaccinated people. Now, I know it sounds like it's been a lot, but the fact is, by the time we can vaccinate, if we can vaccinate another 100 million, by the end of May, we're going to get to herd immunity, and that's 72% is considered to be herd immunity. So this is my favorite slide, of our talk for sure. And so it's important to know if this doesn't motivate you to get vaccinated. Maybe the next slide will. Okay. So let me show you what came out last week from the CDC. Fully vaccinated people. This is what you can do. Okay. You can hang around other vaccinated people. Yay. You're vaccinated. Then fully vaccinated means 2 weeks after your last dose. That's fully vaccinated. Okay. You can hang out indoors without wearing masks with other vaccinated people, or with unvaccinated people from a single household who are at low risk for disease, okay? You don't have to wear a mask or distance, okay? So this is a big step forward. You also, if you get exposed, you really don't have to quarantine, okay, once you're fully vaccinated. So that's a big deal. And hopefully that'll motivate any of you that are on the fence to go ahead and get it done. We can get past it. You can start being with your family, being with, with even folks of another household who have low-risk people in the household. Now, it doesn't mean you can't go in public without a mask. You absolutely still need to keep wearing a mask, keep distancing in public. Be very careful around anybody who's at increased risk, and you all know who those are now. When you're visiting unvaccinated people from multiple households, please still wear a mask. Still avoiding gatherings is important. I think Homewood has done a fabulous job with our mask policy and our distance policy of keeping everybody safe. And that's been wonderful. So this is very exciting for where we are right now. Got a long way to go still, but so that's, these are two big breaking things that have come out just in the last 2 weeks.
No, and again, reasons for hope as we go forward on this. But in addition to seniors, the other group that I find myself concerned about all the groups, but some of them seem more impactful than others, and that's the frontline workers. Not only healthcare workers, but the people who have to deliver food and work in restaurants and have no choice but to work. I wonder, as you are both frontline workers in the healthcare field, what do you see as the psychological impacts that this has had on your profession? I mean, you guys, many of you guys deal with people who you treat, you come to know their families, and they pass away from this horrible thing or have very difficult times recovering. And that's got to have an impact on you beyond the normal rigors of the jobs that you do. How has this impacted your profession, you think?
Yeah, I've lost several patients to COVID, some that I've seen for 20, 25 years, and it's devastating. It's devastating. What's scary is you almost get numb to it. That's what's scary. I have not been in the hospital taking care of sick COVID patients, but the PPE requirements, the stress every day of dealing with those people, and at the beginning of this pandemic, for the first 2 or 3 months, there was a lot of unknowns. There would be people that would come in, we wouldn't know they were positive until they'd been in the hospital, for a day or two. And so we've had, I think the best estimates are 2,500 to 3,000 healthcare workers have died in the U.S. from COVID. That's a problem. I think 15 to 20% were in New York. So you can imagine what they've dealt with there. It's such a paradox because for a lot of providers who were not in the hospital, their practices shut down. Nobody would come to the office. So we had to switch to telehealth, and Becca's done some telehealth, I've done telehealth. Many of you have probably had a telehealth visit with your doctor. Those are challenging, to say the least. Connectivity, you can't hear what they're saying, you're talking to a computer, and I did that for several months, and that's all we did, and that wore you out as well. So it's been a paradox of a change in clinic practice, but also the major stress on the front lines in the hospital of taking care of these sick COVID patients.
Becca, what do you hear along those lines?
Yeah, I was going to comment on this, that what I thought about just as we were talking, I haven't had patients die from it. I see younger patients and adolescents, but it made me think about the impact of seeing a patient and having to wear the PPE. You mentioned the PPE and having to wear the masks and the eye safety goggles, et cetera. Like, just as the provider, and of course the patient's wearing a mask, but just to me, I just find myself challenged on a daily basis in connecting, because a lot of my work is sitting down in a room with a teenager and saying, sometimes it's a well child check, sometimes it's a specific complaint, but a lot of times it's, anxiety, like I told you earlier. Like, we're seeing all these kids with anxiety, depression, all these different things, and I'm asking them to tell me about how they're doing, and I'm sitting here with I feel like it's like 7 layers of separation between me and the person. So to me, that popped into my head as one of the bigger challenges on my end of things, is connecting with people through all the layers of PPE. It's just tough because that connection, that social connection, is the barrier makes it difficult.
I would never ask you guys to violate patient-doctor confidentiality, but are there stories you've heard or incidents you've been involved with that have been particularly impactful to you during this whole crisis?
Well, I have one lady who's 85 years old, and she was in Birmingham, had kind of been estranged by her family, to be honest with you, and ended up moving back to Atlanta, and she and her daughter reconnected. And she started living again with her daughter. She was very debilitated, COPD, really couldn't walk, couldn't ambulate. She's the type of patient that would call me every week, no matter what,
Yeah.
usually at 2 a.m.
Oh, no.
And I just got a call from her grandson, it's probably been 2 or 3 weeks ago, that she had passed from COVID. You know, and this is somebody that we go back 20 years, and she was a challenging patient, but wonderful. We just, it's internal medicine, you just form these lifelong relationships with patients. And the fact that I'm not going to talk to her again is really, really hard to come to grips with. You know, we've had people that have been right on the brink that have been able to come back. And one thing we haven't talked about is treatment right now. If you want to get into that, we can talk about that in a little bit. But Becca might have somebody as well.
Yeah, Becca?
Yeah, well, what comes to mind, the first thing that popped to my mind was this week ago or so I saw 3 siblings in clinic. Me and my partner were both kind of, dividing and seeing family members and siblings. But this family member was an aunt who was really a guardian of these 3 siblings who were 13, 15, 17. And just, it was just sort of, it struck me. And again, the challenge of the last year of virtual schooling, for example. So these kids were in a school system that didn't have a lot of supports. They were doing full virtual school this entire time. The aunt didn't have a lot of support in terms of multiple other people who could help her. Like, again, she was one of these parents that have to leave to go to work, leaving the teens at home to do their virtual school. Well, so as they were there, they're declining in their mental health, they're more isolated. All 3 of them have depression. All 3 of them are just feeling terrible. And it just was just a really sad situation. And that's the scenario that I envisioned when you asked me about stories that struck me, because just in talking with this aunt, who is essentially their mom, and just how to support her and help her find a better way forward, and to help all of them, connect with a counselor or whatever it was. It's challenging. And I feel like it's really sad to say all this. There was hope, there's always hope, but that's the story that.
Well, and I think too that, it's easy to measure the physical impact on this. It's easy to quantify deaths and hospitalizations, but the emotional toll is so great, and I think it's just so hard for us to get our hands around, and our heads around, frankly. And I think it's important for people to understand the emotional impact this has had. But you mentioned, Stephen, that early on in this, when we first announced this session, we had asked our members if they had some questions that they wanted to ask this. And Nathan Heisler, one of our shepherds, submitted a question where he asked about the fact that early on in this pandemic, there was talk before vaccines became available of treatments for COVID. It is presumed that COVID in some form or another will probably be around for a while, but where are we when it comes to the issue of treatment of this disease going forward?
Yeah, I think that's a good question. And what you have to focus on is early outpatient treatment and then hospital treatment. So on the outpatient side, we really have one thing right now. That's the monoclonal antibody infusion. And that's for patients who are 55 and over with chronic health conditions, or really anybody over 65 who develops COVID with really any symptoms in the first week. It's basically like getting the antibodies from the vaccine before you get the vaccine. And it's very effective. We treated about 1,000 people at UAB with the monoclonal antibodies. There's a couple of them. There is no outpatient oral treatment right now. There are several in the works that are looking pretty promising. So that would be like Tamiflu for influenza. That's obviously the hope. You're diagnosed with COVID, you may not have any symptoms, you may get on that oral treatment. We don't have anything like that yet, but there are some things in the pipeline looking pretty good. Medicines like ivermectin and hydrochloroquine and some other things have not been proven in numerous double-blinded controlled studies to have any impact. That's just the reality. In the hospital, there's not a whole lot else either. There's remdesivir. You probably heard about that early on. That is only IV, only for hospitalized patients. That does not exist in the ambulatory community. And then dexamethasone, which is a steroid infusion. That's only given after 7 to 10 days of COVID. You don't give steroids in the first 7 to 10 days of a COVID infection. It gives worse outcomes. So that's really, and this was a lecture at UAB just last week. That's pretty much what you got. And then you've got supportive care. We know a lot more about ventilator management, how to prone patients on the ventilator, managing the respiratory issues and a lot of the, the other side effects that occur that we talked about on that early slide. So that's really where we are right now with treatment. We wish there was more, but the fact is, the fact that we're a year into this with some things in the pipeline and the fact that we're treating sick patients a whole lot better than we did in the first 3 to 6 months of the infection.
Another thing that was discussed very much in the early stages of this was testing, to be able to detect where the virus was and who had it and how many people had it. And that seems to have become less of a issue, even though there have been talks about having access to instant tests where you can maybe
Right.
test yourself at home and determine whether you have COVID. Where are we as far as testing goes?
Well, I think we can be optimistic with testing. I really do. I think that those are going to happen. I think we're going to see that in the next 6 to 12 months. In-home testing, rapid, immediate testing. Currently, you can get tested same day pretty much anywhere you want right now. So that is a good thing. I think testing overall has gone down just with the vaccine. The fact that you don't need to be tested, after you've had the vaccine. And so that's why we've seen cases just dramatically decline.
As we get toward the end of this conversation, I'm curious, Becca, we talk about this impact of mental health, and I'll ask both of you this, but how can we recover? Are we likely to recover from this? Where are we going to be down the road as kids go back to school, and hopefully there's some, and I always hesitate to use the word normalcy in this situation because I'm not sure what that will look like, but how deep is this, and how do you see the prospects for recovery from this looking?
Sure, yes. The first word that popped in my head when you were asking that was resiliency, because I feel that going through this difficult time that we've been going through, especially at the ages of teens and young adults, it can only make you stronger, I guess, for lack of a better way to describe it. That there's going to be these rough times where you need to sometimes get support, or almost always get support, whether it be from your family, whether it be from a licensed professional, a counselor, or someone else, whether it's going to your medical doctor to talk about other things to help you through this time. But I feel like, again, there's a lot of hope on the horizon, and as time goes on, things will improve and we'll be stronger for it. We'll have gone through tough stuff together.
Do you think there'll be greater demand for mental health services as a result of this?
Yeah, I think there already is. It's just, currently there is much greater demand than there was, a year or two ago before this happened. So just wait list. I work a lot with young people who need to be admitted to higher levels of care, meaning like different treatment programs. And sometimes we're looking all around the country for treatment programs to help young people. And wait lists have it's not even like tripled or quadrupled. Like they're just at unprecedented levels of wait because there's so much need for young people with mental health issues.
Stephen, how do you see us recovering from this?
I think we've learned a ton. We've learned a lot. One thing we've learned is how significant some of the disparities were in our minorities in the state. I've got one more slide I'm going to show you. If you'll put the slide up on the screen. And this is one thing Alabama's not doing too badly at. Really, this is an alphabetical list of all the states that are reporting the ethnic rates of vaccination. And Alabama, at 19%, you can see, compared with many other states, is really doing pretty well. And so these are African Americans who have gotten the vaccines. And if you take a look at the percent of deaths, percent of total population, percent of cases, we're better than most other states. So I think one thing that we have learned that is never going to change and go back is that we have got to take every effort we can to figure out why this happens, how we can fix it, what we can do to educate our patients, and to never let this happen again.
Let me ask you a hyper-local question, Stephen. As a member of the church reentry team, what do you see as the prospects for this church resuming some semblance of what it used to be as far as in-person service goes, classes, activities on campus? How does that look to you?
We're closer. We're certainly closer than we were. But if you take a look at the current guidelines that just came out last week, this is still, this is considered a moderate-sized gathering. So while we're wearing masks and social distancing, we can continue. When we're going to be to the point where we can be without mask in classrooms, we've got to get to that 72%. Okay, we've got to get to that herd immunity. Will we be there in May or June? We hope so. I think we need to be very, very careful because we still have variants that are occurring, and there's still some concern about the variants you're hearing about, South African and the UK variant. These are mutations of the virus, which is normal. The virus normally mutates. Influenza does that too. We just don't want to reach a variant where we don't have as much protection. And so we still have to be very vigilant with our at-risk population. So we're not going to be there. I don't think we're going to be in classes in 2 months. No, nobody's saying that. But I think in the summer, I think that's when we can start to reevaluate and figure out, as we've done at Homewood from the beginning, very good creative ways to say, yes, if. Yes, we can do it if we have these things in place.
So as the trends continue, and nobody's saying this could happen this way, but the president says maybe we can have small gatherings by the 4th of July. It sounds like it may be possible that by the fall,
I think so.
we might be
I think it's possible.
very close, if not there.
Possible.
As we wrap up, I'd just like to ask you guys your thoughts on what the road ahead looks like for the virus, for society, the way we react to it, and how it will affect us as people. Becca?
Oh, me.
I know it's an easy question, isn't it?
You're like, Becca, you go first. Oh, wow. I feel like in a lot of ways I don't know for sure. I'm hopeful, again, with all the things that we've talked about with the vaccine, with herd immunity, hopefully, things like that, and us getting back into some semblance of a more normal, like before. Like I said, I'm hopeful about all that coming around. And like I said a second ago, I think we're all gonna take this time and hopefully use it to learn for the future and to be stronger people for what we've been through. I think it certainly has taught me the importance of in-person interaction and how being with people in person is so much more powerful and more helpful to my own mental health. And I think, I even heard recently there was a study that came out about this, that our affective health is much improved in person versus virtual in interactions. So I think it's just made it clear that being together and being with another person is so powerful. And I hope that in the future we'll remember that when we all want to stare at our iPhones as we're sitting in the same room together, or our other personal devices, not all iPhone. But hopefully we'll be like, oh wow, look, we're in the same room together, not wearing masks and full, shields. Maybe I'll talk to you in person and not stare at my device.
You mean I could expect my daughter not to text me from upstairs after this is over?
Exactly.
She'll come down and actually
tell
talk to
us
me?
the adolescents all the time, right? Because I'm like envisioning these young people. But we do it too, right? All of us in the same room on our phones. But I think we'll have learned a lot of things, and hopefully going forward we'll be, again, better for it.
Stephen?
Well, I'm going to appreciate hugs a lot more.
Yeah.
We're going to appreciate being with our parents and grandparents a whole lot more.
Yes.
Missed them. Most of us have not seen them for a long time. I don't think there's any doubt there's always going to be strife and conflict politically in our country. And that was unfortunately, I think, one of the drivers of a lot of the chaos that we dealt with in the past year. We're Christians, and we're talking from a spiritual standpoint. It really helps solidify what's important and where our hope lies. Also, that the fact that science got us where we are today with the vaccine in an unprecedented period of time is something that I'm going to appreciate more too. I have a lot of respect for where I work, for UAB, for the research institution, the academic institutions in our country that have dedicated their lives to this. And it makes me proud to be where I am. I'm really incredibly grateful to be able to do what I do. I think the people that have taken better care of themselves did pretty well with COVID for the most part. You can't say that across the board, obviously. This was a kind of just a very random, folks that would get it and did not do well. But I think it just makes us all appreciate the bond we have here. I get a sense, really the last 2 or 3 weeks, as we've started to see more people here, more kids are here, there's just a really good sense of positive community out in the courtyard, afterwards. All the bouncers getting us out of the lobby, that's fine.
Yep.
But hey, beautiful weather, there's a real sense of hope, I think, and optimism here after just a really terrible, terrible year.
Give us one more time that website that people can find vaccine information.
alcovidvaccine.org.
alcovidvaccine.org.
.org.
And I'm sure that we'll all be checking it out soon. So
Please do.
Dr. Becca Savage, Dr. Stephen Steer, thank you so much for taking part in this conversation. I think you shared some great information. And if people have any questions, they can always find you here, but otherwise just reach out to us, and we want to get back to normal as soon as we can. Thank you for helping us walk down that path a little bit more.
Thank you.
If you missed part of this, you want to watch it over again, it will be on our streaming platform, so you can check it out. As we close out today, I've asked Becca and Stephen if they would pray us out today. So Becca, would you begin, please?
Mm-hmm. God, thank you for just allowing us to be together and have this time to discuss this topic. And thank you for all of the members of this church family and how we still are close and how much we love each other in you. That though we feel distant sometimes and even physically can't be together, that you are still the uniter and the one who brings us all of the hope. That God, none of these things that we've talked about in science and in what's going on with different treatments, et cetera, they're not the source of our hope, but you are. And Jesus, you are taking care of us in every moment and holding us in your hands. And we thank you for that.
Dear Lord, thank you for today. I think we've realized the blessing that every day is that you give to us. Thank you for getting us to this point. Comfort the families that have lost loved ones. Help us to be comforts for them. Help us to grow stronger as a community here at Homewood, that we can love those folks and love those people who need us and need you. Thank you for the leadership here. Thank you for Willie, dedicated his life to serving and reaching out to others. And we thank you for the chance we have to get this information out. We pray that it will be used, that someone might get the vaccine that wasn't going to get it before, and that we can continue on to get back to focusing on serving others and to loving you. It's in your Son's name we pray. Amen.
Amen. Thank you guys again. Appreciate it. Thank you for watching. We'll see you next time.